Greetings. Welcome to the Professional Patient Podcast. I'm your host, Michael A. Weiss. In today's episode, we're going to examine the concept of accountability in healthcare. Physicians now want to be accountable to being efficient, and the beneficiaries of this are going to be patients. But you need to understand a lot of nuances to really grasp these commendable aspirations of doctors, insurance companies, etc. Now, to do that, I've enlisted the help of a friend and former colleague, attorney Dan Frier. So without further ado, let's visit with Dan Frier. Dan, how's it going today?
Going well, Michael. Thanks for having me.
Well, I appreciate you coming on, and, truth be told, people should know that Dan and I know each other because we met when we practiced law at a firm called Brock Eichler, which was many, many years ago. So with that said, I thought it would be interesting to have Dan on because Dan practices healthcare law. So Dan, can you go into your background a bit for us?
Yeah, I've been practicing healthcare law, regulatory corporate healthcare law for the last 16 years or so. And a little over 10 years ago, I started my own firm with my partner, Jonathan Levitt. I handle all the corporate regulatory healthcare matters along with several other lawyers in my firm. And it's been a very interesting ride. The law changes, as you know, virtually daily. So it's never the same day twice.
When people hear that you're a healthcare attorney, some lay people may think malpractice law, things like that, and I know that's not what you do. Can you sort of explain the difference between being a healthcare transactional attorney as opposed to someone who sues doctors for malpractice?
Sure. Yeah, I don't get involved in any sort of malpractice work regarding physicians, either as a plaintiff's attorney or as a defense attorney. Attorneys that handle med mal defense generally work for the insurance companies that provide the insurance. I don't do that. So what I do is I handle all sorts of business transactions between physicians.
Okay, so Dan, I'm going to throw some healthcare-related statements and get your quick take on that, all right?
Sounds good.
All right, number one, do we have a broken healthcare system?
No. We have a broken insurance system.
Are patients now being viewed more as consumers from your perspective when you represent doctors?
Yeah, I do. I definitely see that, 15, 20 years ago, physicians practiced their trade and were not particularly interested in whether patients were happy about it or not, whether their offices looked appealing or not. They were professionals and patients could come if they wanted to and not come if they didn't want to. Nowadays, there's a lot more competition, and I think physicians are beginning to think more like business people.
Do you think technology and social media is moving too fast for healthcare?
I don't think it's moving too fast. I think that providers are moving too slowly. It's incredible that you can track a pair of shoes on the internet as it travels around the globe 16 different directions. A physician can't track the history of one of his or her patients' health care. So, for example, if I go to a doctor, in Arkansas because I'm on a trip there and I need to go to a doctor, that doctor can't tap into my records to see whether I'm allergic to certain types of antibiotics or what my prior medical conditions are. And it's absolutely ridiculous. We've had that technology for 15 years, and it has not been adopted by the healthcare community.
I think that's an excellent point because, I look at banking and, if banking is permitted and people trust banking, I don't know why they don't trust their medical records to the web. And I also see a lot of doctors looking for guidance, I guess from an ethical perspective. What do I do? What do I do? And they're being reactive rather than proactive. So
yeah. I don't put most of the blame on the physicians because if you're a physician and your reimbursement's been going down year after year, you simply don't have the financial resources to invest in the technology. Even though, and it's technology that has it benefits the medical practice, but not significantly enough to offset the cost. What it really does is it benefits the patients and society. And only recently has the government started to realize that and is beginning to subsidize, for example, electronic health records.
Right. Well, now let's get into what you're doing, actually. Can you give me some examples of what medical practices are doing to be either reactive or proactive, given these technological and legislative changes that we're referring to?
But one of the areas where I've been really noticing significant growth is partly just because people have come to me, and it's partly because I've tried to drum up and create the growth in this area is in the area of medical practice consolidation. There are two types of consolidations. One is where you have a group of physicians either in the same or different specialties which are merging their practices into some sort of larger network of physicians, of practices, all within one entity.
Okay.
And that enables the practices to negotiate appropriately with insurance companies to implement certain quality assurance and cost containment protocols. And then the second area is where you have a loose affiliation of physicians that are basically getting together and trying to develop develop really isn't the term, but adopt certain clinical pathways and protocols which will hopefully improve the quality of care that group of physicians is providing, as well as improve the economics of it, so that they can go out and they can say, look, we practice medicine in a more cost-effective way without sacrificing quality. Because at the end of the day, honestly, we have the quality, which is why I said earlier, there is not a healthcare crisis. There's an insurance crisis. There's a reimbursement crisis. We have the quality. We have the most incredible machines out there. The problem is not the technology. The problem is not our level of ability. The problem is that we've reached a point where we can no longer afford to pay for those technologies. And unless we start concentrating on efficiency, there's just, those technologies will sit around doing nothing.
Well, you just used the word I was going to throw back at you. I mean, it sounds like from what you've told me, and we've had a couple of conversations about it, and what healthcare reform is based on. It's all about efficiency. It's better care at a more affordable price that could be attained by more people and be available to more people. Given that, your role as a healthcare attorney, how do you, specifically, if you can give some examples, how do you as a healthcare attorney help these organizations attain that efficiency?
Well, I'm working with a group of physicians right now who they're in the area of OBGYN, and they are seeking to, I can't get to the specifics obviously for privilege reasons, but they're seeking to form a kind of a national alliance which will enable them to develop clinical pathways and protocols that they can all live with. They don't actually create them from scratch. They take them from organizations like ACOG, the American College of OBGYN, other very, very reputable organizations that create these protocols, and they adopt certain protocols among their members. And the idea is to then be able to brand themselves as a group of practices around the country that are accountable for the care that they provide. They're accountable not only for the quality of the care that they provide, but they're accountable also for the cost of the care that they provide. Another thing is I'm part of putting together what are called accountable care organizations. This is a term that's actually used throughout the healthcare bill. An accountable care organization is basically an organization that generally is going to consist of physicians and hospitals and other types of healthcare providers. And these accountable care organizations can do a lot of things that I just described this OBGYN group doing, which is they kind of create a mechanism by which they can provide the highest quality care while maintaining accountability on the physician part. The concept of accountability in healthcare is something that's relatively new. Traditional healthcare involved the following kind of relationship. Patient goes to a doctor's office, and the doctor decides what kind of care to give the patient, and the doctor can decide what kind of care to give without even considering the cost of that care, because his direct customer, the patient, doesn't pay for the care. Mm-hmm. Care is paid by a third party, an insurance company, or by Medicare. And so neither the doctor nor the patients were accountable for the cost of that care. And frankly, in many instances, even the quality of the care, other than through medical malpractice claims. So what's happening now is the government, I think, finally is realizing that in order for the system to be affordable, the previous mechanism was basically enforcement, auditing physician practices, auditing hospitals, and prosecuting individuals when they were involved in fraud. Unfortunately, that is not an efficient way to combat any sort of crime. You see that in the war on drugs. It just doesn't work well. The better way to do it is to make the physician accountable for the care he or she provides, as an example, and make the hospital accountable. So if the physician provides care that's unnecessarily expensive, that physician pays the cost.
Dan, these accountable care organizations, and you and I spoke about this, and I have seen it in the healthcare reform bill. That's an acronym, ACO. Is this an acronym that's going to be around for a while that patients should get used to hearing?
Yeah, I think so. I mean, the jury is definitely out in terms of whether the government can create a mechanism to promote capitalism. I'm kind of skeptical about it. I think that's kind of an oxymoron, but I think that some sort of accountability, whether it's a traditional accountable care organization or some other form, accountability definitely is here to stay, in my opinion. And that's really...
There seems to be a disconnect between insurance companies, who pay doctors for procedures over the past couple of years because technology has made certain procedures easier to do. It costs physicians less, and they also save time. Yet this savings hasn't been passed on to patients. I think this sums up what you said about we don't have a healthcare problem, we have an insurance problem. What do you think about that?
Yeah, it's insightful. I think that what you described is true, and it is ironic because the better the technology has become in most industries, technology results in higher efficiency and lower cost. Look at the computer industry. The relative price of computers has gone down dramatically since the first personal computer. But in healthcare, it's the opposite, and the reason it's the opposite is the incentives are completely off. Again, getting back to the accountability issue, a physician will make more money the more care he or she provides. We have a system that basically rewards physicians for providing more care, not better care, not more efficient care, more care. And unless there's some economic motivation to reduce care or to better improve fees, improve costs, the price of care just keeps going up and up. And I think that's really the essence of the problem.
But I just want to thank you for taking the time to share your thoughts because people who watch this, I think they expect these complicated issues to be broken down into sort of regular speak, and that's sort of the way I speak and you speak, so I really appreciate it, Dan. Thanks for coming.